We're going to have to turn on the microphone.
It does automatically. They do it best.
All right, fantastic. That's great. Fantastic to be with everyone. Thank you for that kind introduction. I do need to say I'm so excited to be part of Brainomics here, but Sandy is the mother of brain health, but she's also the mother of Brainomics. She created the term 10 years ago. It's a trademark of the Center for Brain Health, so Sandy has lots of children out there, great children. So I have the most fantastic panel. We're at the business end of brain health. I've got Sarah Hoit here. Sarah was a social entrepreneur, impact entrepreneur before the term was invented. At Harvard Business School, she wrote the business plan for AmeriCorps. She then became the deputy director of AmeriCorps. I think 6 million Americans have gone through AmeriCorps. She then started a technology-driven education company, a technology-driven assisted living company, and now she's devoting her energies now to improving brain health, and you'll hear from her in a moment. I've got Dr. Harris Eyre, who's I think of as my brother on that. This is the first time I've met him physically. We've been working together for, I guess, 4 or 5 years now. All of you probably know Harris. He is one of the world's, perhaps the leading person bringing together people around the world to think about brain health. He's also the leader of this term that he's going to explain, brain capital. This term was invented by our dear friend Bill Wilkerson in Canada back in the 2000s, and Harris has done more to expand and bring this to the forefront, and we'll talk about brain capital. I've got Eric Bennett, who has a unique history. He's one of Texas's leading investors. He was the founder of the Tolleson family office, I think back in 1998. He's the CEO of Tolleson Wealth Management. But he took time out from that to join the Center for Brain Health. And did everyone enjoy the building we were just in, the Brain Health Performance Institute? So Eric was the one with Sandy who actually built that building. So please give him a big hand for that. So he has a unique perspective on investment in business and brain health because he's an investor for decades, but is also someone who's helped run and build this the Center for Brain Health. So fantastic panel. We'll get right into it. I don't even really need to ask any questions. It turns out that the panel got together secretly yesterday and compared notes, so they know what they want to say. But we'll have a highly interactive session. My only role here is to interrupt and change the speaker when someone is going on. I don't want to say too long because it's all very interesting, but everyone has to speak. But I'm going to start with Sarah. At the beginning, ask her a simple question is, you've done so many things, you've already had such an impact on the world, you could retire. I know that you enjoy Cape Cod on that, but you're really focused, devoting your life now to the brain health and bringing brain health throughout the nation, throughout the world. Can you just tell us, before you tell us what you need to do, tell us why you're doing it?
Well, thank you, first of all, with gratitude. A lot of the why is in this room. I think a number of us have been on this passionate journey for a number of reasons. And I've spent as you said, my career as a social entrepreneur. So before that word existed, purpose and the why was always what got me up in the morning. Sometimes I think we're given the situations in life that we're supposed to attack, and as I think many of you know in our conversations, I was actually ironically CEO of a technology company focused on trying to connect an aging population when everybody thought I was crazy, like that's not going to happen, right? But along that journey, my husband was diagnosed with early onset, and so while I was working with thousands of families and people on their journey, my children and I were facing it. At the time, they were 11 and 12. And we lost him about 18 months ago. And so if I wasn't already in this with every fiber of my being, I'm in this with every fiber of my being. And there are people in this room, we talk about, I listen to Amy like, I'm here with my people. These are my people. I mean, the face is out here. There's people who, you know who you are, and people like George, who's like a best friend and a father and a compatriot and everything to me. We've been on this journey because we see our kids and our grandkids' faces. Sandy's a sister from another mother. So I'm here for a lot of reasons. I very much believe in the private sector and the double bottom line, but also personally, I am passionately committed.
Thank you for sharing that. We'll come back in a few minutes to find out how we're going to get that double bottom line on that. Eric, as I said, you have a unique perspective on that. You've been an investor for decades. You built the Brain Performance Institute. Tell us, what you're seeing and how the world's different 10 years ago in terms of investment and business in brain health.
Yeah, so
maybe we have a slide that's going to show up, or maybe not. No slides. Okay, we're coming.
So I'm going to speak from through the lens of a venture capitalist. So it's a little bit different than policy and grant making. So when I came to the Center for Brain Health in 2013, I saw some neat things going on, like perhaps some venture capitalists would be interested in this. And I got the big no. We were not. They thought it was cute, science fair, was not ready for prime time. And I would honestly say that. So it got me really almost infatuated with the idea of investing in the brain. And so from 2013 through 2021, we started investing in biotech, life sciences, healthcare. The brain was not many companies were interested in the brain at all. And I would say that the past 3 years, really 2 years, I've seen more activity in the brain and mental health space than I saw in the prior 10 years. And that's very encouraging. So all of a sudden, biotech funds, they want to hear about the brain. There's at least 15 brain-focused venture capital funds being raised right now. I knew of like 1 3 years ago. So there's a lot going on that wasn't going on. And if I could add the why real quick, is that why did all this change? And I think a lot of things came together at once the past 3 years. One is COVID really accelerated the awareness of mental health and the problems. Two, this Alzheimer's drug that got approved by the FDA, although somewhat controversial in the medical field, it gave investors a hope that there was a path to profitability in the biotech sector for the brain. So there was a big black hole, and that drug being approved, no matter what happens to it, it opened up a tiny little hole, and people are going in. So I talked to a venture capitalist the other day in the life sciences space. Immunology and neurology are the hottest spaces right now in biotech investing. So it's very encouraging to hear. And in addition to Dr. Amy Cruz talk about some of the neat, new, novel things going on with devices, TMS. I was talking to Dan Krozik about light therapy. There's some new novel things going on. Psychedelics, I have to mention, there's some solid science behind psychedelics. And so there's a lot of innovations going on that aren't traditional therapeutics, drugs and biologics. They're really starting to advance. So you're just starting to see more interest in the area. And of course, family offices, there's a lot of very wealthy people are on the spectrum or are affected by some neurodegenerative disease, so they're willing to fund it. So I'm very excited about the investing in the brain, and I would say 3 years ago, if I was to talk to you guys, I'd be kind of neutral on it.
Okay, well, we'll come back, as you know, a little bit, because I want to talk about some of the ethical issues with these investments. But Dr. Harris, I promised the audience you would explain brain capital. So we all understand physical capital. We all understand natural capital. Many of us understand, maybe all of us, social capital. Now we have brain capital. What is brain capital, and should we care?
Sure. So thank you, Andrew, for organizing this event, and to my co-speakers. Thank you to Sandy and team for organizing this event. It is a family affair, it feels like, today and tomorrow, so that's a good term, Sarah. So brain capital, as Andrew mentioned, was pioneered by a Canadian businessman and a politician about 10 years ago. They published a nice report on it, and then it kind of went dormant. And so I found it a few years ago, and I thought, this is super powerful. So, how do we make our brains as important as GDP and road and bridge infrastructure? Brain capital is an economically engineered term that gives us the ability to do that. So a lot of what I do today is I go around and I talk to politicians and senior business leaders and say, brain health across the lifespan and brain skills like creativity, adaptability, resilience, that should be as important as GDP and road and bridge infrastructure. We can measure brain capital if we look at certain measures, and we know, of course, that the cost of brain health disorders is in the trillions of dollars every year. So brain health disorders, mental and neurological, are sapping our economic security, which is related to our national security in the US. So that's brain capital. We talk about it, with people at the city level, at the state level, at the national, and at the global level. We did a great event last year at the UN General Assembly on brain capital. So brain capital is also meant to be a big umbrella, something that we can all agree makes sense, whether you're a psychiatrist or a neurologist or a brain health person. So it's my attempt to try to, I played a lot of soccer growing up, I like teams, so it's my attempt to try to make an umbrella for the teams. And then maybe just let me say, as I try to think about what is my role in the brain health world, I think of myself as maybe a bit of a policy wingman to the brain health community. I'm interested in, I recognize all the grassroots research and projects that are going on. I thought to myself, how can I be most useful as a team player to brain health? And so I've spent the last 5 years of my life going into policy land, public-private policy, that interface between government and big business, economic policy, financial policy. Yeah.
So I'm going to come back to you
Anyway,
in a few minutes and
okay,
ask
all right.
you how it's going. So
Okay,
we'll
good,
do all
good.
that. Okay, so we asked Sarah why she is here and why she's focused on brain health, and she told us it's very personal for her. Now I'm going to ask her, okay, we understand that, but what do we do about it? What are the what are you working on that's going to make a difference to brain health? I know you've been convening a lot of the largest corporations in America and the world, and other groups. You've convened us, the Center for Brain Health, as part of it. You've built this coalition. What's the coalition going to do to impact brain health?
So, you know, I really do think, and others have said this, I think we're in a unique moment in time.
Sorry, let me just add.
Yeah.
You can jump into, you guys had your meeting yesterday. You jump into the conversation anytime. I don't want to be the only one interrupting, so.
Well, I think you said it really well, Eric. We are in a very unique moment in time. You see these moments in time. I saw it with national service. I mean, post the pandemic, the entire world is focused on brain health. I mean, it's just, you know, if there was one amazing outcome from the horrific moment we went through and focused on it, as Sandy tries to remind us, you know, birth to death. This is everyone. This is everyone's problem. And so I think that our opportunity and what we are doing in this moment, that profound sense that we have to do this together, that we are a team.
Okay, but
Yeah.
I'm the CEO.
Yeah.
You've convened me, and I say, I get it. Brain health, I have a brain. It's
What
really
are we doing?
important. Just
Yes.
just tell me what to do next.
Okay, so we are builders, and so we are trying right now to bring government, public sector, private sector, and in particular the youth in these brain health innovation Olympics that many people in this room are a part of. We have corporations, we have institutions, we have the scientists, and we have young people from literally all over the world who are working with us to build brain health centers of excellence that we will deploy. We don't want to talk about it like Sandy said, we want to do it. I'm an entrepreneur, so I don't want to do anything that is not going to be built. So we have collected the Army, and we have also involved the government in this because we absolutely need their support if we're going to get after the health equity and other issues. So right now, as part of our global brain health initiative, we have launched the Olympics. And the Olympics have about 30 judges. All of you who are not judges already, you're welcome to join. And about 40 young people from 9 countries. And in about 8 weeks, we're going to have a lot of their phenomenal thoughts on what we should be doing based on all the science. And then we're going to put our minds together and we're going to deploy some of these brain health centers of excellence in 3 different locations at least. Senior living in places we age. We have an amazing leader here, Lori, who is going to be launching some brain health centers of excellence from Avanti. Military bases and with veterans. And college and university campuses, as Sandy and others have said, we must focus on the mental health crisis. And of course, the workplace.
Okay, so I'm going to come back to you and Harris, actually, and talk a little bit about the role of the government, because I'm a little bit skeptical about that. But I want to talk to Eric about something. Here is just, you know, we talked before this session, and I was a little bit worried about the ethics of the of brain health investments. I mean, and it was triggered a little bit. I mean, as Stephen said, I've been out of the United States for 36 years, so it's a little bit of a time warp when I came back, and I was in CVS getting my flu shot or my COVID shot, and there was a display that said neural supplements. And it made me really stressed out. I mean, what was any evidence that this helped? So, and then of course we had the brilliant young people come in and give the presentations of what they're doing with neural implants and other devices. So I need to ask you, thinking about as an investor, what are the ethical issues around this? I mean, ethical and safety issues around this investment, and you know, how do we safeguard against the potential for really a negative, you know, a negative outcome?
Great. I'll answer that first, and I want to add something that Sarah said when I'm done answering the ethics question while it's fresh in everyone's mind. So the one thing I learned, and I'm not a scientist, I have an undergraduate in finance. I took geology in college and got a B. That's my science background. But I learned that if it's not evidence-based, you talk about supplements, you know, so there might be some supplements that are evidence-based, but most of them aren't, but people are still taking them. You know, Posit Science, Brain HQ, when I was here, you know, you had this thing called Lumosity going on. You remember that? And I don't know if they're around anymore, but they got fined by the FTC, I think, because they were making claims that brain training was good, but not their brain training. So as an investor, the biotech world, the life sciences world, they're not going to invest in things that are not evidence-based. That being said, think about Theranos. If you guys remember that, the blood test that turned out to be a sham. There were a lot of famous investors that invest in that. So it's not that they're not going to be mistake-free, but that was not evidence-based. So when I look at things, and not even being a scientist, actually one of the first calls I make is to Harris. I said, Harris, is this BS or not? And he looks at it and says, it's got some hope or pass. And there's a few other people in the room.
So between the regulators and the investors, there is a discipline in the investment space.
Well, the regulators, yeah. I mean, so the FDA. So these are things that potentially aren't even FDA approved, because some of the stuff in the brain world is so novel, it doesn't have that traditional path to FDA approval, like a drug or a device would have. So it would be just someone making false claims or making claims that what you're doing is working. And you know, Sandy and I went through something with a local company that was making all these claims about fixing PTSD and traumatic brain injury by putting you in this machine. And one of the things that I look at too is like testimonials are great. We all love them. They might inspire us. But I look at if I'm looking at a company, I'll look at their testimonials, but I need to find that science button on their website. And if I click on the science button and they're talking about the science of something generic that closely relates to them but doesn't relate to them, it doesn't carry weight. I want to see their science.
So I shouldn't worry so much. I should be, we're on the right path. Okay, you had something else you wanted to add.
Yeah, I just wanted to add, like you talk about, my takeaway from what you talked about is this ecosystem development, you know, in the brain world. And in the investment world, you know, the ecosystem for brain investing certainly has evolved, but what's helped is that there's different types of investors. So is Brian Chambers still in the room? So, you know, the Capital Factory, they're an incubator, okay? So when you first invest in a company, they used to call it seed investment. So that was the first round of investment. Well, guess what they have today? They have these things called pre-seed, all right? So this is not quite ready for seed, but we're still going to invest in it. And if you're not ready for pre-seed, you have these firms called incubators. And if you're familiar with Pegasus Park down the street, there's like 5 or 6 incubators down there. And so and there's a firm in Austin that helps people like think about things. Is this a grant or is this an investment? And if it's an investment, we're going to structure it that way. And if it's a grant, we're going to help your foundation structure it legally so it's a grant. So there's a big gray area in the brain world on what's a grant and what's investable, and this ecosystem being developed through incubators, firms that can help decide between the two, is wonderful for the brain.
Okay, so I promised that I would put to Sarah and Dr. Harris the question about the government. I come from a little bit of skeptical, you know, I'm from the government, I'm here to help, doesn't give me a warm feeling. So maybe Harris, I'll let you start first about this. I mean, you know, one strategy is a very bottom-up strategy. Different communities embrace brain health strategies and it kind of works its way up. But is there a role for more top-down thinking in the overall brain health strategy? Okay. And also, I mean, you've been out trying to convince governments at different levels for 5 years. Have you convinced anyone?
Well, you helped me in the Nigerian context to start to make some headway. So you're a co-conspirator in this regard. I think we are making progress. I mean, we did this great event at the United Nations General Assembly last year. The governor of Washington State was there, the Secretary of Health for California. We had the Argentine congressman. We're making progress, and I'd like to say that We now did so well at the last UN General Assembly. We have 4 days of programming that we need to fill this year. So please come and talk about how we fill this programming. Sandy, I'm looking at you in particular. So we are making progress, but it's all about narrative and storytelling. You know, brain capital, brainomics, brain health, these things are all very important. But let me try to I'll try to give you a reasonable answer to your question about government. So brain health issues are for sure impacting the economic security of nations. This is not trivial. Brain health issues and population aging, as George and I often talk about, is reducing the credit rating of governments. This is a big financial and economic problem. And if we have economic problems, we have national security problems. So it's a problem for democracy as well. So we do need top-down approaches. The Europeans, Switzerland, Finland, and Denmark have national brain health plans. So I would like us to think about a brain health plan in Texas. First of all, maybe what we will do is we'll learn from what the Europeans have done, develop a brain health plan toolkit that allows you to make a brain health plan in your jurisdiction in a way that you want to. In Texas, it probably means less government. In Scandinavia, it means a lot of government. But I don't think in Texas we're going to get a heavy-handed government involved here. But so let's make this brain health plan toolkit for the world. We can use it in Nigeria, we can use it in Argentina, we can do it in Texas. But then let's specifically make a Texas brain health plan that works for all the stakeholders across Texas, probably involves a lot of business, a lot of philanthropy, and probably stitches into the Texas Brain and Mind Bill plan that we can talk about as well.
Well, I'll come back to you in a little bit and ask what the people in this audience can do to advance the Texas forward. I just also put in maybe one economic fact. The labor participation rate in the United States is about 77, 78% for working age adults. In Scandinavia, in Denmark, or in Finland, it's about 88%. That different. If you don't get your Social Security check when you're a little bit older, it's that difference that's the difference between economic viability and real pain on that. So, and a lot of that difference it hasn't been explained well enough. But I won't commit the center to it. But in my view, as the Brainomics leader, I think most of that difference in labor participation is due to brain health challenges. Okay, so
I'm up next on that question.
I have to say, so I met Sister Sarah when I was invited to an event that she organized in Washington. I was supposed to speak, but I got pushed out by Senator Gillibrand, Senator Gillibrand, because she was on a whatever clock in the vote, and I was just speaking and about to say something, and she rushed in, and I never got to speak. But that's all right.
That's not
Sarah,
true.
No, but Sarah, every event I've been with Sarah, she does such a fantastic job. A shout out for our public servants. That I've made some maybe negative remarks about the government. The truth is, there's many great public servants that do incredible things, and there's no bigger champion of those public servants than Sarah. But explain how in this venture, public-private partnership, and the brain health journey, what role do you think the government is going to play it, whether it's at the state level, which we'll come back to, or at the federal level in the United States?
Well, I must say, to comment on your on that event, that really was quite funny, as you have senators coming in and out trying to vote. They have to vote. They've come. Someone else is speaking. You go. You do a vote. You think you have your logistics down, right? And then the next thing you know, you got people running in and out. Let me use one example, because this could be an entire day's conversation. I do believe that there are many pieces of this issue we cannot solve, and corporate America can't solve on our own. I'm a firm believer in corporate America being involved, but in partnership. Let's just take food as an example, a very big example. Food is medicine, health equity, food deserts. You get into these big conversations. There are phenomenal corporations like Sodexo. I think Sodexo's out here in the audience somewhere, that I've worked with very closely, who are working with us on trying to bring the Mind diet and healthy eating to millions of people in millions of countries. They're one of our good corporate leaders. They can't afford, corporate America can't afford to go serve everyone in poverty. The economics don't work. The governments have to understand. And there are people like Cory Booker, and we are working on food as medicine initiatives where the government understanding that to step in and provide the food and the economics of the food, if we just took that one piece and to talk about that, is a critical piece where we have to have the payers being both the government and insurance companies, to think about this, because corporate America can't just step in or they go out of business. and solve it on their own. That doesn't work. So I think that's, one of the many areas. I also believe we have to get our young people involved. I am an ultimate believer in the purpose and the idealism of a younger generation, and I believe in movements. And we have scared them away from healthcare. We have scared them away from the aging spaces. And we have to engage them differently and let them know they're powerful, they're needed, change agents. Even you go back to something like AmeriCorps, to have loan forgiveness for people getting into healthcare and to some of the areas that we really need help. So the government, there are lots of innovative things we can do and must do to solve these problems, because no one of us, I think I honestly, in the end, that the amount of talk here and the beauty of the partnership and collaboration, we're all at a point where we can choose what we do, and we choose to be here together, and that belief that we have to get investment in whatever ways we can. That is everything. That's corporate America, that's foundations, that's nonprofits, and it absolutely has to be the governments, or we can't solve these larger issues.
Okay, no, you can interrupt. You don't have to put up your hand. It's not
Okay, well, so, and just to reinforce this point about public-private, and maybe we could say public-private philanthropic partnerships. So my argument is, and I've been working with George on this, and we're going to publish something with the Brookings Institution soon, is that our current economy is brain negative. The current economy is typified by...
I would say we have business models that consume brain capital. The most obvious one is Instagram or Meta.
Yeah.
So people are aware 36 states are suing Meta for destroying brain capital. They don't quite put it in that term, but that's what's going on. So you're privatizing profits and socializing the losses, which we saw in 2008 as well, but we won't go back there.
Oh,
okay,
but it's beautiful. That's why we're friends. So that's an example. That's an example of a brain negative economy. The brain negative economy also has an industrialized food system, which is churning out salt, sugar, and chemical-rich food, which is not good for our brains. It tortures our microbiome. It gives us depression and anxiety and accelerates dementia. There are a series of issues in a brain negative economy that are massively problematic in a world where our brains are so important to creativity and the future of our lives. Okay, so we need a transition.
Is this the first time you used the term brain negative economy?
Yeah.
Okay. Can we remember this moment? This term is really important. The brain negative economy. The structure of the economy in the developed world is brain negative, and it is not sustainable. Dr. Harris Eyre owns it.
And I'll just finish by saying that so we need to transition to a brain positive economy. And we will not get to a brain positive economy unless we have the public sector and the private sector and the philanthropic sector involved. The public sector doesn't need to, it can regulate some things, but it can incentivize the private sector to invest more in whatever you want, neurotech, neuroengineering, whatever. Philanthropy can come in when there's super high risk. But so that's why I think public-private and philanthropy can't be disentangled. But to your point, we can't always have massive government intervention. We need to the government can play little bits here and there, in some countries a lot, some countries less, but at least we can all agree that this common goal of an economic transition is where we kind of need to get to. Otherwise, where are we going to be in 20 years?
Okay, so just hold that thought, Sarah. Let me get Eric to jump in here. You're Texan, right? One of the few people that's Texan.
No, I wasn't born here, so apparently I'm never a Texan.
No, Texas is so welcoming, but you've been here a very long time, embedded in the fabric. And of course, Finnish strategy, Danish strategy, sounds like countries in a state, but the truth is Texas is a lot bigger than any of these countries. So what do you think of the idea of a Texas brain healthy strategy, and what do you think the important elements of that would be? And how do you think the people like you are going to embrace a Texas brain healthy strategy?
Well, Texas has a lot of advantages because we're an entrepreneur, particularly Dallas. It's an entrepreneurial
What
first.
about Houston?
I haven't spent as much time there, even though my wife is from there, but probably. But yeah, and I would say all of Texas. It's just an easy state to do business in and get stuff done compared to some other places. So, but we're behind Boston and the Bay Area by far in terms of IP, intellectual property being developed and new technologies. But we're starting to move in the right direction. So I'm really excited about Texas just because of the culture and mindset that people have here, the can-do.
But would you stand up in front of the leaders? Every leader in Dallas knows you. Would you stand up and say, "Brain healthy strategy for Texas. I'm behind it, and here's why we should be doing it"?
Oh, sure, yeah. And one thing a local philanthropist here. I'm sure a lot of you know who she is. You know, is developing Pegasus Properties, and her mission is for Dallas and Texas to be a hub for biotech in the world. And through her involvement and her team's involvement, we were able to land the ARPA-H location here in Dallas, and that's a pretty big deal. So there's
$1 billion, right?
Yeah, it's a big deal. So there's a lot of stuff going on, but it's all relatively new. I mean, people did not think about Texas much in the biotech community. So when I would go meet with people in Boston or the Bay Area, they're appreciative that we were investors, and thought it was cute that we lived in Dallas. But 5 years ago, there started to be all of a sudden some IPOs and sales from UT Southwestern. All of a sudden, they got their interest, and they started asking me, so tell me about the UT system. Tell me about all this. So I think Dallas is definitely heading in the right direction. And I should add that, one of the most successful things that was done here was CPRIT it was state funding for cancer. And I don't know how long it's been around, but it's given billions of dollars to cancer research. Yeah. And we've tried to pass a similar bill twice for brain, and it's failed twice. And we're not going to stop. I know, Harris, you may or may not be getting involved in that. And but I think that hopefully third time's a charm and we can get it passed, because that would be a big deal for us.
We'll let Harris jump in. I know he has a lot to say about that in a minute, but I want Sarah. I know she wants to say something. Sarah, what's on your mind?
No, I also don't want to undercut the private sector piece of this. I think it's massive, and all three of us are working very closely on that and believe in, first of all, the funding. Hats off to Amy and others. We need to have much more investment in this space. But if you just think of some of the other work that we're doing, which is working with some of the world's largest corporations, let's just go take the world's largest corporations. So we're talking to them and we're working with them. We had a whole bunch of them at Harvard Faculty Club last week representing.
Is there any resistance, or is everyone?
No, there is not resistance. When you turn around, listen, if I were to get up tomorrow, just cold, hard business, don't care a thing about anything, I just want to make the most money possible, I would focus on longevity and brain health. If I were to get up tomorrow and try to figure out how I can do the most good in the world, it would be longevity and brain health. And they understand, as we start talking about their workforce, their product, their brands, they affect billions. When we were in Washington, that meeting together, we represented like 6 billion consumers and 4 million plus employees from the people in that room. And so if we just start there, we spend 80% of our time at work, and to really all these things we've learned about today that are really would be groundbreaking and game-changing for their revenue, for their ROI, for their employees' happiness, for their productivity, but also to think about, I try to make them sit down and say, what can we do right now with what you have in your product base to change this? And then what do we need others? What is AI's role? What are the roles of working with others? How do we partner?
Okay, let me stop you there. I want Harris
That's a big part of it.
All right, I've got that. All right, Harris. I want you to jump in. So we're all excited about brain health here. We've celebrated Mother Sandy. I'm sure there are other things that she's the mother to. And we're all really pumped up. And yet you've just told, or Eric told us, but I know you know a lot about this, that twice the Texas legislature has turned down a bill about brain health, which for a relatively small amount of money, $3 or $4 billion, which for this economy is not much. So just, connect the dots for me here. How are we going to make progress on brain health if something so obvious is not able to get through the Texas legislature? And we're talking about this Texas strategy with the government.
Yeah, so this is super exciting, and it's very sensitive because we're right in the middle of this politicking of this. But so Texas has previously done CPRIT, Cancer Prevention Research Institute of Texas, $6 billion of state bond funding for cancer research. And it's the reason why Texas is the best in cancer research globally, MD Anderson, for example. So we need something for the brain. The comptroller of Texas says that we'll have a surplus in the next legislative session next year, starting in January, of $20 billion, potentially up to $40 billion. So it is possible that we could take some of that surplus and put $3 billion into brain and mental health research and brain health research. And so we need to work closely with politicians in Texas, particularly the lieutenant governor. The Meadows Mental Health Policy Institute is instrumental in this. Pegasus Park, Sandy has been instrumental in helping get me involved in this. This is the 4th time we've failed. So we failed 4 times. We have one more chance, right? And so my friends who just walked in, Rob Kaplan and Ronell, are big supporters and helping me to think this through and ultimately going to help us co-lead this to develop a statewide stakeholder group, veterans, private sector, women's groups, patient advocacy groups from neurodevelopmental conditions in kids through to degenerative disease in older adults. So this is a historic opportunity for Texas to not just catch up to California and Massachusetts, but to overtake them. And so we need to be real careful and real smart in the next 12 months to land this thing.
Okay, so I want to open it up now, questions to the audience. We've had kind of a spirited discussion, as they say in diplomatic circles, on there. And I have many more things I could ask, but I'll just throw it open to the audience. There's a hand up there. Is there a microphone?
Yes, they've got them.
Right here, there's a gentleman. All right, stand up. Give your name, sir.
Is on? Can you hear me?
Yeah.
So my name's Aaron Seitz. I'm the director of the Brain³ Center for Mental Fitness and Wellbeing at Northeastern University. My question is, I'm just curious whether you think that kind of modern IP culture leads to a brain negative economy. And my thought there is that basically, solutions to positive brain health involve integrating multiple solutions that are coming from multiple directions. And it seems that at least in the space of startups, that IP is used to kind of cut down competition and prevent people from coming up with good solutions. This is a premise. You could disagree. I'm just curious your thoughts.
Well, I mean, it's a brilliant question.
That's what you always say when you don't know the answer.
Exactly. I'm trying to buy myself some time. Look, I think I'm not an expert in the role of patents and intellectual property in business competitiveness. You have a point that I can see both sides of the coin, basically. So I'm giving you a non-answer. I can see that getting rid of patents is helpful because it increases transparency amongst inventors and entrepreneurs and can improve integration. A lot of the problem we have in the startup system is that we have point solutions. Everyone's got a silver bullet for one diagnostic thing or a treatment thing or prevention thing. And I've been an entrepreneur and I was guilty and involved in that. And so we need to develop integrated systems, particularly for health systems who are just frustrated with all these point solutions being fired at them. But on the flip side, why private sector investors and government investors invest in companies is because partly in the intellectual property is part of how they get their equity and position. So if we get rid of that, then the investment appetite is going to dry up. So it's a I'm sure that there's people smarter than me that think about this, but I can see both sides and but it's a good challenge. I'm going to think about it more.
Eric,
Yeah, I think in the healthcare world, it's tough not to have IP. I mean, there's plenty of businesses and industries that don't have IP, including the one I'm in, managing money. But the big saying is, you want to have a moat around your business that where you have people might be able to compete with you. Either you can do it better, you have some angle where you can do it better. And in biotech, that moat largely is IP until the IP runs out. And then, of course, the Inflation Reduction Act affected some small molecule drugs where it reduced the IP years you had, and that's really rocked that world. And that's not necessarily the brain world, but it's rocked that world.
Okay, I think we have another question here.
Hi, Kelly O'Brien with Us Against Alzheimer's. Thanks, everyone. Thanks, George.
Kelly, thanks for coming. We're really happy
thanks.
to have you here.
Thanks. Wingman Harris, I just want to say that if you could do for my dating life what you have done for brain health, I'd be married by now. So first off, thank you, because I think that is the best description of what you have done for this community in this field. I just want to express my gratitude there and pose a challenge. As you all know, I'm interested in answering this question, something I wake up and think about every day. We've launched a business collaborative for brain health at Us Against Alzheimer's. This is on my mind, but I wanted to pose it to the panel because I also know this is something you all think greatly about. I'm wondering if you could share with me or in the group examples of CEOs, not HR directors, not benefits managers, but CEOs of companies who, by the way, do not sell brain health products. So as much as I love her, Ariana Huffington wouldn't qualify, for example. I would say HKS, I'd put in this category, right? So that would be one example. But I find it very few and far between, and I've been to many, many events like this, all of us have, and there are very few CEOs of companies in here, in these rooms, very few. So who are they? How do we find them? How do we get to the top?
All right, Sarah, you can take the hard question
Well,
first.
I'm talking to partners in crime here because I couldn't respect anybody more than Us Against Alzheimer's and the work that we're all trying to do together. Kelly, I think, you and I front line on this. I think with the CEOs, they have to see, first of all, what's in it for their bottom line. They have to see the ROI, and the way that at least I've been able to try to get into some of the conversations I'm in right now is showing them first the economics and secondly the impact. But to see that they go hand in hand, sometimes it's trying to pick the ones where their product line actually can help. So the obviousness of taking a piece of their product line or a piece of their delivery and moving it forward. I think all of us know this is not mainstream, that still brain health can have negative connotations. So throwing in the longevity, the healthy living, we try to, that fear of someone's testing my brain. So working on our language and how this is not frightening. But I certainly don't sit here with the answers. I know I'm trying. I do believe that from a branding and a product and at least a revenue motivation, if you can catch them there first, that everybody wants to do good if they can also do well. So
Okay, let me stop you there. I'm being told my clock is inaccurate for some reason.
Oh, we blew it on time.
30 seconds. Closing.
Okay, so I think I love this business collaborative for brain health. We should all go and talk to Kelly and learn about it. There's two things. One is we need to talk to business leaders in their language. How does workplace brain health reduce accidents? How does it reduce cybersecurity risk? Things like that we don't normally think about in brain health. And the second one is these corporate CEOs are competitive. So let's, as you're doing, I know you're doing this, let's make this ETF for brain healthy companies and only include the best 10 in that, and make CEOs compete to have the most brain healthy workplace driven by data that you're working on, so that they make sure that they're high up in that list and in that ETF, and BlackRock can have that ETF, and everyone's going to love it.
Okay,
and the
I'll
CEOs
buy that
will compete.
ETF. All right, 30 seconds, Eric.
I would
We're
just
done.
say that one of the fun things about being in investing is it does two things. One, it shortens the time horizon from scientific to discovery to reaching people, which is a big problem. And secondly is scale, right? So if you can help 10 people a week in a clinic, that's great, but how do you help thousands of people? And businesses have to scale, and businesses are incentivized and are very good at scaling.
All right, give it up for a fantastic panel on that.
So fun. Well done.
All right. I just